Acanthamoeba infection is caused by a microscopic organism called Acanthamoeba, which is commonly found in water, soil, and even air. This type of infection often affects the eyes, leading to a condition known as Acanthamoeba keratitis, which can cause severe pain, redness, and vision loss, particularly in contact lens wearers. It can also affect the skin or central nervous system in immunocompromised individuals. Diagnosis typically involves examining the cornea and taking samples, while treatment may include anti-amoebic medications and sometimes surgical intervention. Preventive measures include proper contact lens hygiene and avoiding exposure to contaminated water. Actinomyces and nocardia are both types of bacteria, but they have some key differences. Actinomyces is a gram-positive anaerobic bacterium that usually lives in the mouth and is associated with infections in the jaw and face, often following dental procedures or poor oral hygiene. It can lead to a chronic condition called actinomycosis, characterized by painful lumps and pus formation. On the other hand, nocardia is a gram-positive aerobic bacterium that is found in soil and can cause opportunistic infections, particularly in people with weakened immune systems. It leads to nocardiosis, which can affect the lungs, brain, and skin, and is often more serious because it can spread throughout the body. Diagnosis for both involves laboratory tests, and treatment typically requires antibiotics, but the specific types and duration of treatment can vary significantly between the two. Anaphylaxis is a severe and potentially life-threatening allergic reaction that occurs rapidly, often within minutes after exposure to an allergen, such as certain foods, medications, insect stings, or latex. It is characterized by symptoms such as difficulty breathing, swelling of the throat and tongue, a rapid drop in blood pressure, hives, and a fast or weak pulse. Because it can progress quickly, anaphylaxis requires immediate medical attention, usually treated with an injection of epinephrine, which helps to reverse the symptoms. It's crucial for individuals with known severe allergies to carry an epinephrine autoinjector and to seek emergency help immediately if they experience symptoms of anaphylaxis, as prompt treatment can be life-saving. Anthrax is a serious infectious disease caused by the bacterium Bacillus anthracis, which can form spores that survive in the environment for long periods. It primarily affects livestock, but humans can become infected through contact with infected animals, contaminated animal products, or inhaling spores. There are three main forms of anthrax: cutaneous, skin, inhalational, lungs, and gastrointestinal, digestive system, with cutaneous being the most common and least severe, presenting as sores or ulcers. Inhalational anthrax is the most dangerous, causing severe respiratory issues and potentially leading to death if not treated promptly. Diagnosis is based on clinical signs and laboratory tests, and treatment typically involves antibiotics, which are most effective when given early. Vaccination is also available for people at high risk of exposure. Escheriasis is an intestinal infection caused by the roundworm Ascaris lumbricoides, which is one of the most common human parasitic infections worldwide. People usually get infected by ingesting eggs found in contaminated food, water, or soil, especially in areas with poor sanitation. Once inside the body, the eggs hatch into larvae that migrate through the bloodstream to the lungs and eventually return to the intestines as adult worms. Symptoms can vary from mild abdominal discomfort to severe complications like intestinal blockage, depending on the number of worms present. Diagnosis is typically made by detecting eggs in stool samples, and treatment usually involves antiparasitic medications such as albendazole or mebendazole, which are effective in clearing the infection. Preventive measures include improving sanitation, practicing good hygiene, and ensuring safe food and water sources. Aspergillosis is an infection caused by a group of fungi called Aspergillus, which are commonly found in the environment, particularly in soil, decaying plants, and dust. There are several forms of aspergillosis, with the most common being allergic aspergillosis, which affects individuals with asthma or cystic fibrosis, leading to allergic reactions and respiratory symptoms. Another serious form, invasive aspergillosis, primarily affects people with weakened immune systems, such as those undergoing chemotherapy or with HIV/AIDS, and can cause severe lung infections and even spread to other organs. Diagnosis is based on clinical symptoms, imaging studies like CT scans, and laboratory tests that identify the fungus. Treatment typically involves antifungal medications, but invasive aspergillosis can be life-threatening and may require surgical intervention. Preventive measures include avoiding exposure to environments where the fungus is prevalent, especially for at-risk individuals. Botulism is a rare but serious illness caused by a toxin produced by the bacterium Clostridium botulinum. This toxin can affect the nervous system and lead to muscle paralysis. There are several types of botulism, including foodborne botulism, which often results from consuming improperly canned or preserved foods that contain the toxin. Infant botulism, which occurs when infants ingest spores of the bacteria, often found in honey, that then produce the toxin in their intestines. And wound botulism, which occurs when the bacteria enter the body through a wound. Symptoms typically include blurred vision, drooping eyelids, difficulty swallowing, weakness, and paralysis. Diagnosis is based on clinical symptoms and laboratory tests that detect the toxin. Immediate treatment with antitoxin is crucial to neutralize the toxin, and supportive care may be necessary for severe cases. Prevention focuses on safe food handling practices and avoiding honey in infants under 1 year of age. Candidiasis is a fungal infection caused by an overgrowth of Candida, a type of yeast that normally lives in small amounts in the body, particularly in areas like the mouth, throat, gut, and vagina. When the balance of microorganisms is disrupted, Candida can multiply and lead to infections which can manifest in different forms, such as oral thrush, white patches in the mouth, vaginal yeast infections, itching, discharge, and irritation, and invasive candidiasis, which can affect the bloodstream and internal organs, particularly in immunocompromised individuals. Risk factors for candidiasis include antibiotic use, diabetes, a weakened immune system, and hormonal changes. Diagnosis is typically made through clinical examination and laboratory tests that can identify the yeast. Treatment usually involves antifungal medications, which can be topical for localized infections or systemic for more severe cases. Preventive measures include maintaining good hygiene, managing underlying health conditions, and avoiding unnecessary antibiotic use. Chagas disease is a tropical parasitic infection caused by the Trypanosoma cruzi parasite, primarily transmitted through the bite of infected triatomine bugs, also known as kissing bugs. It is most common in Latin America, but can also occur in other regions due to globalization and travel. The disease has 2 phases: the acute phase, which may present with mild symptoms like fever, fatigue, and swelling at the bite site, and the chronic phase, which can develop years later and lead to serious complications affecting the heart, digestive system, and nervous system. Diagnosis is typically confirmed through blood tests that detect the parasite or antibodies against it. Treatment is most effective when initiated during the acute phase and involves antiparasitic medications like benznidazole or nifurtimox. Preventive measures focus on improving housing conditions, reducing exposure to kissing bugs, and screening blood donations in endemic areas. Cholera is an acute diarrheal illness caused by the bacterium Vibrio cholerae, which is typically spread through contaminated water or food. It is characterized by sudden onset of severe watery diarrhea, vomiting, and abdominal cramps, leading to rapid dehydration and electrolyte loss. If left untreated, cholera can be life-threatening, especially in vulnerable populations like young children and the elderly. Diagnosis is usually made through stool tests to identify the bacteria. Treatment primarily involves rehydration, either orally or intravenously, to replace lost fluids and electrolytes. Antibiotics may also be used to shorten the duration of the illness and reduce the severity of symptoms. Prevention focuses on improving sanitation, ensuring access to clean drinking water, practicing good hygiene, and, in some cases, vaccination in high-risk areas. Prompt recognition and treatment are crucial to reducing mortality associated with cholera outbreaks. Chronic granulomatous disease, CGD, is a rare genetic disorder that affects the immune system, specifically the ability of certain white blood cells called phagocytes to kill certain types of bacteria and fungi. This happens due to a defect in an enzyme complex known as NADPH oxidase, which is essential for producing reactive oxygen species that help eliminate pathogens. As a result, individuals with CGD are prone to recurrent and severe infections, particularly from catalyst-positive organisms like Staphylococcus and Aspergillus species. Symptoms can include fever, swollen lymph nodes, and skin abscesses. Diagnosis is made through specialized blood tests that measure the function of phagocytes. While there is no cure, treatment typically involves antibiotics to manage infections, antifungal medications, and sometimes interferon gamma to boost immune function. Preventive measures, such as good hygiene and avoiding exposure to certain pathogens, are crucial for managing the condition and reducing the risk of infections. Clostridium difficile infection, CDI, is caused by the bacterium Clostridium difficile, which can lead to severe diarrhea and colitis, particularly after the use of antibiotics that disrupt the normal gut flora. CDI typically occurs in healthcare settings, but can also be acquired in the community. Symptoms include watery diarrhea, abdominal pain, fever, and, in severe cases, complications like toxic megacolon and bowel perforation. Diagnosis is usually confirmed by detecting C. difficile toxins in stool samples. Treatment involves stopping the offending antibiotics and starting specific antibiotics, such as vancomycin or fidaxomicin, which target the C. difficile bacteria. In recurrent cases, additional strategies like fecal microbiota transplantation may be considered to restore healthy gut bacteria. Preventive measures focus on good hygiene practices, including thorough hand washing and cleaning contaminated surfaces, as well as responsible antibiotic use to reduce the risk of CDI. Congenital syphilis is a serious infection that occurs when the syphilis-causing bacterium Treponema pallidum is transmitted from an infected mother to her baby during pregnancy or childbirth. This can lead to a range of health problems for the newborn, including low birth weight, premature birth, and various physical deformities. Symptoms may not appear immediately, but they can develop over time and may include skin rashes, fever, irritability, and developmental delays. Diagnosis is confirmed through blood tests that detect the infection in the baby, usually conducted shortly after birth. Prevention is crucial and involves screening and treating pregnant women for syphilis during prenatal care to avoid transmission to the baby. If congenital syphilis is diagnosed, treatment with penicillin is effective in curing the infection and preventing further complications. Early detection and treatment are essential to improve outcomes for affected infants. Creutzfeldt-Jakob disease, CJD, is a rare and fatal neurodegenerative disorder caused by misfolded proteins known as prions, which lead to the progressive degeneration of brain tissue. CJD can occur in several forms, including sporadic, the most common, hereditary, and acquired, through exposure to infected brain tissue, often from medical procedures. Symptoms typically include rapid cognitive decline, memory loss, personality changes, visual disturbances, coordination problems, and eventually severe neurological impairment. Diagnosis is challenging and often involves a combination of clinical evaluation, medical history, brain imaging, and tests to rule out other conditions, as there is no specific test for CJD. Unfortunately, there is currently no cure or effective treatment, and management focuses on supportive care to improve quality of life. The disease progresses quickly, usually leading to death within a year of symptom onset, making awareness and early recognition critical for patients and their families. Cryptococcal meningitis is a serious infection of the protective membranes, meninges, surrounding the brain and spinal cord, caused by the fungus Cryptococcus neoformans. This infection is particularly common in people with weakened immune systems, such as those with HIV/AIDS, but can also affect healthy individuals. Symptoms often include severe headache, fever, neck stiffness, sensitivity to light, and altered mental status. Diagnosis is typically made through a lumbar puncture, spinal tap, to analyze the cerebrospinal fluid, which may show the presence of the fungus or its antigens. Treatment involves antifungal medications such as amphotericin B combined with flucytosine to effectively control the infection, though it may require prolonged therapy. Early diagnosis and treatment are crucial, as cryptococcal meningitis can lead to serious complications, including neurological damage and death if left untreated. Preventive measures, such as regular screening and prophylactic antifungal therapy, are important for individuals at high risk, especially those with HIV/AIDS. Cysticercosis is a parasitic infection caused by the larval stage of the Taenia solium tapeworm, which is transmitted through the ingestion of eggs found in contaminated food or water, often associated with poor sanitation. When a person ingests these eggs, they can hatch in the intestines and form cysts in various tissues, most commonly in the brain, muscles, and eyes. Symptoms vary depending on the location of the cysts. Neurocystic urcosis, which affects the brain, can cause seizures, headaches, and neurological deficits, while cysts in muscles may cause pain or swelling. Diagnosis typically involves imaging studies like CT or MRI scans to visualize the cysts and serological tests to detect antibodies against the parasite. Treatment may include antiparasitic medications such as albendazole or praziquantel, along with supportive therapy for symptoms. Prevention focuses on proper hygiene, cooking pork thoroughly, and ensuring access to clean water and sanitation facilities to reduce the risk of infection. Cytomegalovirus, CMV infection, is caused by the cytomegalovirus, a common virus that belongs to the herpes virus family. While many people are infected with CMV in childhood or early adulthood, it often remains dormant and typically causes no symptoms in healthy individuals. However, in people with weakened immune systems, such as those with HIV/AIDS, organ transplant recipients, or newborns, CMV can lead to serious health complications, including pneumonia, retinitis, eye infection, and encephalitis, brain infection. In infants, congenital CMV infection can result in developmental delays, hearing loss, and other long-term issues. Diagnosis is usually made through blood tests that detect CMV antibodies or the virus itself. While there is no cure for CMV, antiviral medications may be used to manage severe cases, especially in immunocompromised patients. Preventive measures include practicing good hygiene, especially hand washing, and screening pregnant women for CMV to reduce the risk of congenital infections. Dengue fever is a viral illness transmitted to humans primarily by the Aedes aegypti mosquito, which thrives in tropical and subtropical climates. The disease is caused by the dengue virus, and its symptoms typically appear 4 to 10 days after being bitten by an infected mosquito. Common symptoms include high fever, severe headaches, joint and muscle pain, rash, and mild bleeding. In some cases, dengue can progress to severe dengue, previously known as dengue hemorrhagic fever, which can lead to serious complications like bleeding, organ impairment, and even death. Diagnosis is usually made through blood tests that identify the virus or antibodies produced in response to the infection. While there is no specific antiviral treatment for dengue, supportive care such as hydration and pain management is essential. Prevention focuses on controlling mosquito populations and reducing exposure to bites, including using insect repellent, wearing protective clothing, and eliminating standing water where mosquitoes breed. Vaccines are also available in some countries for individuals with a history of dengue infection. Diphtheria is a serious bacterial infection caused by the bacterium Corynebacterium diphtheria, which primarily affects the throat and nose. It spreads through respiratory droplets from coughs or sneezes of an infected person, or by touching contaminated surfaces. The hallmark of diphtheria is the formation of a thick gray or white coating in the throat, which can lead to difficulty breathing, swallowing, and severe sore throat. Other symptoms may include fever, weakness, and swollen glands in the neck. If left untreated, diphtheria can lead to severe complications, such as airway blockage, heart problems, and nerve damage. Diagnosis is made through clinical examination and laboratory tests to identify the bacteria. Treatment involves the administration of diphtheria antitoxin to neutralize the toxin produced by the bacteria, along with antibiotics like penicillin or erythromycin to eradicate the infection. Vaccination with the diphtheria tetanus pertussis DTP vaccine is the most effective way to prevent diphtheria and is routinely given to children, with booster doses recommended for adults to maintain immunity. Elephantiasis is a condition characterized by severe swelling and enlargement of body parts, most commonly the legs and genitals, due to the accumulation of lymphatic fluid. This condition is often caused by parasitic infections, particularly lymphatic filariasis, which is transmitted through mosquito bites. The parasites, such as Wuchereria bancrofti, invade the lymphatic system, leading to blockages that prevent proper fluid drainage and result in swelling. Symptoms may include thickened, hardened skin and an increase in size of the affected areas, which can resemble the skin of an elephant, hence the name elephantiasis. Diagnosis is made through clinical examination and laboratory tests to detect the presence of the parasites. Treatment focuses on managing symptoms and preventing secondary infections, as there is no cure for the underlying lymphatic damage. Preventive measures include mosquito control and the use of medications in endemic areas to reduce the number of infected individuals. Early detection and intervention are essential to improve the quality of life for affected individuals and prevent complications. Giardiasis is an intestinal infection caused by the microscopic parasite Giardia lamblia, which is commonly found in contaminated water, especially in areas with poor sanitation. People can become infected by drinking water that contains the cysts of the parasite, consuming contaminated food, or through person-to-person contact. Symptoms typically appear 1 to 3 weeks after exposure and may include diarrhea, abdominal cramps, bloating, nausea, and fatigue. Some individuals may experience no symptoms at all, while others may have a more severe illness that can last for weeks. Diagnosis is usually made through stool tests to identify the parasite or its antigens. Treatment involves the use of specific antibiotics, such as metronidazole or tinidazole, to effectively eliminate the infection. Prevention focuses on practicing good hygiene, such as washing hands thoroughly, drinking safe water, and avoiding raw food in areas where giardiasis is common. Understanding giardiasis is important, especially in travelers and individuals living in or visiting endemic regions, as it can lead to significant gastrointestinal discomfort and impact overall health. Group B, Streptococcus, GBS. Infection in infants is a serious bacterial infection caused by the bacterium Streptococcus agalactiae, which can be present in the vagina and rectum of pregnant women. Infants can become infected during labor and delivery if they come into contact with the bacteria, leading to potential complications such as pneumonia, meningitis, or sepsis. GBS infections can occur early, within the first week of life, early onset disease, or later, between 1 week and 3 months of age, late onset disease. Symptoms in infected infants may include difficulty breathing, lethargy, fever, irritability, and feeding problems. Diagnosis is made through blood cultures to identify the bacteria. To prevent GBS infections, pregnant women are typically screened for GBS during the 3rd trimester, and those who test positive may receive intravenous antibiotics during labor to reduce the risk of passing the bacteria to their newborns. Early recognition and treatment of GBS infections in infants are crucial, as prompt medical intervention can significantly improve outcomes and reduce the risk of serious complications. Hand, foot, and mouth disease, HFMD, is a common viral infection primarily affecting children, caused most often by the Coxsackie virus. It is characterized by the appearance of painful sores in the mouth and a rash on the hands and feet, but it can also occur on other parts of the body. The disease spreads easily through close contact, respiratory droplets, and contaminated surfaces, making it particularly common in daycare settings and among young children. Symptoms typically include fever, sore throat, reduced appetite, and discomfort from mouth sores, which can make eating and drinking difficult. Diagnosis is usually based on clinical examination and the presence of characteristic symptoms. While HFMD is generally mild and self-limiting, treatment focuses on relieving symptoms, such as using pain relievers and maintaining hydration. Good hygiene practices, such as frequent hand washing and disinfecting toys and surfaces, are essential for preventing the spread of the virus. Understanding HFMD is important for managing outbreaks in communal settings and ensuring the comfort and health of affected children. Herpes simplex virus type 2, HSV2 infection, is a sexually transmitted infection primarily responsible for genital herpes, which is characterized by painful blisters and sores in the genital and anal areas. The virus can be transmitted through direct skin-to-skin contact during sexual activity, even if the infected person does not have visible sores. After the initial infection, HSV2 becomes dormant in the nerve cells and can reactivate periodically, leading to recurrent outbreaks. Symptoms during an outbreak may include itching, burning sensations, and flu-like symptoms, such as fever and swollen lymph nodes. Diagnosis is typically made through a physical examination of the sores, and laboratory tests can confirm the presence of the virus. While there is no cure for HSV2, antiviral medications such as acyclovir can help manage outbreaks, reduce the severity and duration of symptoms, and lower the risk of transmission to partners. Education about safe sex practices and open communication with partners are crucial in preventing the spread of HSV2 and managing the condition effectively. Hookworm infection is a parasitic disease caused by two main types of hookworms, Ankylostoma duodenale and Necator americanus. These worms penetrate the skin, usually through bare feet, and then migrate through the bloodstream to the intestines, where they attach to the intestinal wall and feed on blood. Common symptoms of hookworm infection include abdominal pain, diarrhea, fatigue, and anemia, which occurs due to blood loss from the worms feeding on the host. Diagnosis is typically made through stool tests that identify the presence of hookworm eggs. Treatment involves the use of antiparasitic medications such as albendazole or mebendazole, which effectively kill the worms. Preventive measures include wearing shoes to avoid skin contact with contaminated soil, maintaining good sanitation practices, and improving access to clean water. Understanding hookworm infection is important, especially in areas with poor sanitation, as it can lead to significant health issues, particularly in children and pregnant women who are more vulnerable to the effects of anemia. Influenza virus infection, commonly known as the flu, is a contagious respiratory illness caused by influenza viruses, which can lead to mild to severe illness and, in some cases, death. The virus spreads easily from person to person through respiratory droplets when an infected person coughs, sneezes, or talks, and it can also be contracted by touching contaminated surfaces and then touching the face. Symptoms typically appear suddenly and may include fever, chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, and fatigue. Some individuals, particularly young children, the elderly, and those with weakened immune systems, may experience more severe complications such as pneumonia. Diagnosis is usually based on clinical symptoms, but laboratory tests can confirm the presence of the virus. Treatment primarily involves rest, hydration, and over-the-counter medications to relieve symptoms, while antiviral medications can help shorten the duration of the illness if taken early. Annual vaccination is the most effective way to prevent influenza, as the virus mutates frequently, making it important to update the vaccine each year. Understanding influenza is crucial for public health, especially during flu seasons, to reduce transmission and protect vulnerable populations. Kaposi sarcoma is a type of cancer that is characterized by the growth of abnormal blood vessels, leading to the formation of tumors on the skin, mucous membranes, and other organs. It is most commonly associated with human herpes virus 8, HHV8, and is often seen in individuals with weakened immune systems, such as those with HIV/AIDS. The lesions typically appear as purplish, red, or brown spots or patches on the skin, particularly on the legs, face, and mouth, and can sometimes be painful or itchy. There are different forms of Kaposi sarcoma, including classic, endemic, African, epidemic, associated with HIV, and iatrogenic, related to immunosuppressive therapy. Diagnosis is usually made through a physical examination and biopsy of the lesions. Treatment options vary based on the severity and extent of the disease and may include antiretroviral therapy for HIV-positive patients, chemotherapy, radiation therapy, or surgical removal of lesions. Understanding Kaposi sarcoma is important, especially in the context of HIV/AIDS, as it serves as a marker for immune system health and can significantly impact the quality of life for affected individuals.